Hi, this is Dr. Naidu, and today I'm going to show you where exactly we put breast incisions when we're doing a breast augmentation. So there are three main incisions. One is the inframammary. So this is when we're putting the incision right here in the little crease underneath the breast. This is probably the most popular incision that we're using in the United States these days. And the reason why is that it provides beautiful access to the breast. We can get right underneath the breast tissue and the breast muscle from this incision. We can see the entire breast up to the thoracoacromial vessels, which are located right here. We can go to the medial aspect, and we sometimes will need to lower the inframammary fold, but this is a fantastic incision to use. So that's probably the most popular one. The second most popular one is probably the perioral incision. And by perioral, I mean that we're going in the inferior aspect of the areola, that's the pigmented part around the nipple. We're not going around here. Generally, we only do that if we need to lift the nipple for some reason. But that incision is right here. So that's the inferior areolar or perioral incision. It's also a very good incision location. It's great because you can get to the bottom part of the breast very easily. And then if you swing around, you can get up to the upper part, the upper pole of the breast, and do your dissection. This is the best incision for patients who have tuberous breast deformity because it lets us lower that breast. I'll talk more about tuberous breast in another video, but it's really a fantastic incision for that. The third most popular incision is what we call the transaxillary incision, and that's the one that's located in the armpit. Some surgeons love this incision. Some don't use it at all. I use it very infrequently just because I find that these two incisions give me such good access to the breast. This incision doesn't give me the best access. In theory, it should, but you need to use an endoscope, which is like a little camera with a scope to really get in there and see everything. Some surgeons will do it what we call blindly. They'll put in an instrument and just dissect out bluntly the tissue. I'm not a big fan of that. I like to see exactly where I'm going so that the implant gets into good position. But some surgeons do use this and use it very well. The last incision, which you may have heard of, is the transumbilical. This is pretty much not used anymore because look at how far you have to go from the belly button up to the breast. It's very hard to dissect up cleanly that way. That's a very long route for an implant to take. The other thing is that silicone implants aren't going to fit through this small incision. You can put silicone through here, here, and the transaxillary. You can do that through a relatively small incision, but putting silicone through the transumbilical and trying to bring it up to the breast doesn't work. You can put saline implants in that way. This incision is generally not used by most of us in the United States. We're not big fans of this incision. We generally will use inframammary, perioral, or transaxillary, depending on who you're going to. This is my personal favorite incision because it gives me good access to the breast. I also like perioral. It heals beautifully. The only issue is that there is a slightly higher risk of capsular contracture, which is scar tissue around the breast when you're using this incision. And the thinking is that bacteria from the breast tissue is entering the breast and entering the capsule around the tissue that way and forming that firm scar tissue, that capsular contracture. The transaxillary incision is very nice, but again, for me, I find myself a little bit limited in terms of my visibility. And the transumbilical is something that, like I said, I don't use at all. So that's just a quick video on the different incisions that we use for breast augmentation. I hope this is helpful. For more information, please go to my website, www.naiduplasticsurgery.com, and thanks for watching.